Perfect. Thank you so much, Brittany. Well, first of all, hi, folks. Welcome. We're so excited to have you here and to talk about Third Spaces. This is Beyond Programs, how Third Spaces strengthen community connection and prevention. And for over a decade now, Institute for Public Strategies has been working with Third Spaces. So we're so excited to showcase what we've learned, give you a little bit about the experiences we've had, and just talk about Third Spaces. So without further ado, my name is Gaby Rojas. I am a program manager at our LA office. And particularly, I manage a prevention education program in Metro LA with a focus on the city of West Hollywood.
Hi, and I'm Ruby Ramos. I am the prevention specialist for our Central Valley program in San Bernardino County. All right, and just to take a quick moment, we are a part of the Institute for Public Strategies. So we are a nonprofit organization that has been a leader in upstream prevention for over 30 years. And our mission here is that we work alongside communities to build power, challenge systems of inequity, and protect health while improving quality of life.
Yeah, and our vision is to see safe, secure, and vibrant, healthy communities where everyone can thrive. And today we're going to explore a lot of fun things. In particular, though, we're going to talk about what third spaces are,
Why they matter for prevention,
how they function as an environmental strategy,
how to design, activate, and sustain them.
and a real world case study from West Hollywood, which will be exciting. And a little sneak peek on the right, we have a picture from our fabulous New Year's Eve party, and that's the Midnight Toast. But without further ado, I'm going to pass it over to Ruby.
Awesome. Thank you, Gaby. Well, first and foremost, we do want to talk about, well, what is a third space? So, this term was originally coined by a sociologist by the name of Ray Oldenburg, and it is used to describe an informal gathering that is really anchored in community life. So, this is distinct from home and work and is considered essential to social health. And a simple way to break that down a little further is you can think of your first space as your home, your second space as work or school. And then, of course, that third space is a voluntary gathering, and it is considered to be open, informal, and rooted in community.
And when we think of third spaces, we really want to focus on these five main principles. First and foremost is we want to think about equity and accessibility when thinking about third spaces. So we want these spaces to be free or low cost, physically accessible, and actively inclusive of populations that are underserved by existing gathering spaces. That also goes with our next one, which is cultural relevance. We want these spaces to feel culturally relevant. So that means having programming that reflects the identities, traditions, and values of the community being served, not just, a generic model being kind of imposed onto people. That never really works. Hand in hand with that, we have our third principle here, which is community ownership. So that's when, having residents and community members shape the space from design to programming. And this is ensuring that there's long-term buy-in and sustainability, which is so important to again, sustainability of these spaces, right? Our fourth core principle here, for the sake of prevention, is substance free. So this type of like established norm is established through environment and expectation, not in enforcement, right? We want to make the sober spaces feel natural and a celebrated baseline, as opposed to something that's being imposed onto people. And lastly, our fifth core principle here is we want these spaces to be designed for connection. So whether it's the physical layout, programming, or activities, they need to be explicitly structured to encourage genuine human connection in any form.
Awesome. Thank you for that, Gaby. So now we're going to take a moment to talk about third spaces versus traditional prevention. And we want to start by saying that both approaches have value. But what is unique about third spaces is that they do offer something that our traditional curriculum based prevention cannot, and that is a shift in the environment itself. So rather than simply delivering a message to an audience, third spaces can really reshape the social conditions that make substance use either more or less likely. So, here looking at traditional prevention, this is what we consider curriculum based programs with a defined content. So, these are typically time limited, whether that's through a workshop or a series. They are delivered to participants by facilitators such as ourselves, and they really target individual knowledge and attitudes. Now, what's different over here with third spaces is we consider this an environmental strategy. So that means it is embedded in community life, it is ongoing and reoccurring, it is part of the social fabric. So, as Gaby mentioned with those core principles, they really want to be community led and co created so we can target those social norms and collective behavior.
Yeah, and so why use an environmental strategy, right? Why is that our focus here? The answer is pretty simple. The environment shapes norms. Where people gather and what those spaces normalize powerfully shapes behavior. So communities with few visible substance-free alternatives face kind of an uphill battle. And this is because the built environment itself is telling a story about how people are supposed to socialize. And what that story is very particular, right? We tend to see things like bars and venues dominate, so we see high density of alcohol serving spaces, and that really reinforces the norm that fun equals substances. That goes hand in hand with this idea of a lack of hobbies and lack of sober third spaces. And that's because, when there's a lack of those options, there's no visible counter narrative, which then leaves the bars and venues to dominate even more, right? And this kind of creates a cycle in which we see an environment where drug and alcohol related harms are prevalent. So because bars and venues dominate so much, because there's a lack of sober third spaces, we see things like DUIs, see things like ER visits related to drugs and alcohol, and overall just an uptick in drug and alcohol related harms, which then makes those drug and alcohol related harms part of the norm, which is a vicious cycle, right? And so our big point here is that, if you change the space, you change the norm. Third spaces directly intervene in the social environment, making substance-free belonging visible and celebrated. And overall, we like to think of social norms and environmental cues as stronger predictors of substance use than something like individual knowledge. So ultimately, when the environment changes, we see behavior change, which is why we're focusing on this environmental strategy so much.
Yes, and now we also want to take a moment to talk about the social context. So, why does this matter now? And that's because the social fabric that once supported our organic community connection is frayed. And this does have measurable public health consequences. One of the first and foremost ones being rising isolation and loneliness. So, the US Surgeon General declared loneliness a public health epidemic. So, 1 in 2 Americans right now have reported measurable feelings of loneliness. And the loss of third spaces impacts all ages, but particularly it hits older adolescents and young adults the hardest. And that goes right alongside those fewer free gathering spaces. So, public spaces for gathering are underfunded and are disappearing from many of our neighborhoods. And the reason why it's hitting young adults and adolescents so hard is because they are in crucial stages of development. So, third spaces enable repeated social interaction, which in turn builds stronger relationship skills and confidence. Without them, there are fewer opportunities to connect and a higher likelihood that they will experience loneliness. There's also that commercialized and substance centered social life. As Gaby mentioned, bars, restaurants, clubs are dominating. And a lot of these venues have largely shifted to where spending money and alcohol consumption are central to the entertainment aspect, which does impact accessibility and normalization. There's also those shifting social dynamics. So, what we're seeing right now is that digital connections have not replaced the protective depth of in person community. And although online spaces can help through interest based communities, they are generally most effective when they lead to real world or in person interactions. So, really taking this social context as a whole, we encourage you to think in terms of these key elements. So, accessibility, economic factors, temptation, and technology are all important to consider when designing third spaces.
And as Ruby mentioned, we're seeing a diminishing of third spaces, but what does that look like, right? So think of an American Main Street or like a downtown, any sort of like hub. Those places are shrinking. Everyday community spaces like laundromats, barbershops, and rec centers are disappearing and leaving fewer places for people to connect. So if you look at these charts here, you'll see things like art spaces, civic spaces, even groceries and libraries, religious spaces and retail spaces, they're all going down. I think the last year represented here on this chart is 2014. So as you can see, from 2014 onward, they are just diminishing by large amounts, right? So folks aren't able to talk to somebody at the barber shop or do a little laundry and get a little chat in. Those things aren't as normal as much, right? And there's just less, as Ruby mentioned, there's less spaces for youth as well. So these diminishing third spaces really have an impact on our community.
Yes, and now we also want to understand why are people consuming alcohol. So it is very important to consider what is the perceived short-term social benefits of alcohol consumption versus the impact of long-term health risk. So over here, alcohol is considered a social lubricant, whether that's due to curiosity, peer influence, or really the desire to connect with others can really make alcohol feel like it's easy. It makes you more social, makes you feel more comfortable in group settings, or at least that is the perception of consumption. There's also that immediate high value reward. So things such as relieving boredom, boosting mood, and temporarily enhancing confidence or performance can seem really appealing from the outside when it comes to alcohol consumption. We also want to be mindful of mental health conditions. So, alcohol is often used as a form of self medication, whether that's to cope with stress, anxiety, or other mental health challenges. Alcohol temporarily numbs difficult emotions or provides relief, but as we know, that is only temporary. And of course, substance use disorders. Now, it's very important to remember that a substance use disorder is not a moral failing. So, repeated alcohol use does lead to dependency, loss of control, and can make it very challenging for an individual to stop consuming alcohol, even when they are faced with harms or risk. So we really want to think in terms of key elements of fun, connection, building positive coping skills or habits that do not center around alcohol when it comes to designing third spaces. And if you are interested in learning more about behavioral economic strategies to reduce alcohol and drug harms, there is a wonderful presentation by Dr. James Murphy that was hosted by our Binge and Underage Drinking Initiative at a learning luncheon, and you can find that full video on YouTube.
And so we've kind of set the stage a bit, right? Our third spaces are diminishing, loneliness is on the rise, so is substance use. And so all that has kind of led to this idea that connection is protective, right? The research is clear and consistent. Social belonging is one of the most powerful protective factors against substance use. So third spaces don't just feel good, they work, right? So when we really focus and prioritize connection, we see things like a decreased substance use risk, belonging and social integration are associated with lower rates of alcohol and drug use across all age groups, which is amazing. And then on the flip side, you see the rise of things like resilience. This kind of pro-social engagement builds individual and community resilience, which is a core protective factor in every major prevention framework. Alternatively, you also get a rise in just protective factors in general. Third spaces directly strengthen the bonding, belonging, and social support that something like the social prevention framework and coalition models identify as essential. And so our big thing here is, connection is protective and social support predicts a lower alcohol and cannabis use. And third spaces are purpose built to create that support at a really large scale, really bringing that sort of connection to these communities in a way that feels tangible, easy for them, and just overall enjoyable.
Awesome. So now we can introduce the playbook. So this is our Third Spaces playbook. And this was developed in response to the real results that we're seeing in the field and how clear it became that communities need a way to turn any promising ideas into consistent action. So this playbook helps translate efforts into a practical guide for implementation. And that begins with our community demand for structure. So coalitions and prevention practitioners need a shared framework. These are not just examples, they are a clear structure that can be adapted into the own unique needs and interests of our communities. We also wanted to address the sustainability planning gap. So, what we've been seeing is that many of these third space activations were one time events. However, this playbook is designed to help communities build recurring, lasting spaces. And last but not least, it was built from practice and science. So the playbook really integrates lessons from our real world activations with prevention science, strategic prevention framework principles, and of course, best practices for community organizing. All right, so now we're going to take a moment to overview what the playbook covers. So we do consider this a comprehensive practitioner ready resource. It does include the core principles that we talked a little bit about earlier in the presentation, which includes equity, cultural relevance, and community ownership, which is a non-negotiable. This is a community-centered framework that emphasizes the co-creation and sustained participation. We'll also talk about planning and design anywhere from space, programming, and accessibility. We'll also cover sustainability resources, outreach channels, and how you can integrate prevention messaging in a way that is natural without disrupting the community feel. All right, so what is that community-centered framework? Well, we really urge you to think of this as 5 interconnected elements that are being used to design welcoming third spaces. And this is truly more than just a linear checklist. We consider this a living process. So it typically begins with listening, whether that's through listening sessions, community input, asset mapping, and gap identification. We really want to know our community, what their needs, what their interests are, and of course, what resources we can bring into the space. We also want to design for joy. So, simply put, hosting a third space sober event doesn't have to be boring. You can have themes such as a disco night, a karaoke night. You can include interactive elements, and of course, things that resonate with the culture that make people actually want to show up to the space. And of course, making it visible. Okay, as Gaby mentioned, what is the norm becomes part of the environment, and using strategic partnerships, community outreach really helps sustain that strong public presence. And then integrating prevention lightly. And the reason we're saying lightly is because we want prevention to be a texture. We don't want this to feel like a lecture. So, using resources such as resource tables, QR codes, and even soft messaging can really help that prevention feel like a natural part of the community. And then, of course, gathering feedback and repeat. We really like to emphasize continuous learning, iteration, so you can really deepen that community ownership over time. All right, so I know that's a lot of information, but we're going to keep on going. So, into our planning and design, and it's really crucial that we take a moment to consider access in third spaces. So, truly, access isn't just about hosting an event, it's about understanding the realities that shape who can show up. So, one of the ways that we understand our community members is their time and capacity. So, design spaces that reflect how people actually live. Many community members work long shifts and may only have time off at night or on the weekends. So, it's very important to be considerate when you're having these third spaces that allow people the chance to participate in a third space that meets them where they are. We also want to recognize structural barriers. So, substance use does not occur in isolations. This includes factors from income, transportation, secure housing, food access, and the social environment that influence community members' choices. So, we really urge you to look beyond substance use in isolation and examine the broader social determinants of health. When we recognize these structural realities, it really helps organizations and coalitions move beyond blame and towards meaningful change. Third spaces are also a great opportunity to bring resources directly into the space. So, this could be anything from immigrant support groups, mutual aid networks, our diaper distribution programs. Whatever the community needs are, this is a tangible opportunity to have them available, build trust, and address those immediate needs. And of course, starting small and thinking long terms. Pilot events can create immediate opportunities for connection that also contribute to broader community change. Simple initiatives like coalition potlucks, resource sharing, or family friendly gatherings really can do a lot to address any of their needs and can help improve quality of life, both on the individual and community level. All right, so now we can talk about really putting that framework into practice. So this is all about moving from inspiration to action, and you can use these next steps to apply that community-centered framework to your community. So, of course, now that we just talked about accessibility, it is important to identify underserved populations, find out who is not being reached by current prevention or community infrastructure, and target your planning and your resources towards those community. It is also really important to map your local environment. So, audit gathering spaces, nightlife density, and any existing substance free options. We always like to say we don't need to reinvent the wheel. If there's already places that people are gathering that are not that are substance free, tap into those. This goes right along with partnering with trusted organizations. So, this really ensures that those third space efforts are supported with current prevention goals. And oh, actually, I'm so sorry. Those two things are mixed up. So, this is actually working with groups that are already connected to the community that help host, promote, and co create the experience. And it's also really important to consider your coalition and funding priorities. Third spaces are fun to put on, but they are costly. So we really want to be mindful of our budget and our capacity. And you also start with launching a pilot event. So even one visible event that invites people to show up and connect is a great opportunity to start making third spaces more part of the normal social fabric. You can also use these pilot events to gather your feedback. So, whether that's through conversations, surveys, or observations, this is your opportunity to learn what worked. We have this saying in public health, not about us, without us. If you are bringing a third space activation into a community, consider their input, consider what they liked, again, what worked, what didn't work, and use that to build a recurring model. So this is what is designed for repetition. Whether that's monthly or seasonal, we really want to anchor our third spaces into community life. And now we're going to take a brief moment to talk about a few common challenges. And anticipating obstacles is part of good planning. So these are a few of the most common barriers that communities have faced when launching third space activations. One of the first and foremost being low early turnout. So attendance and engagement concerns are common in the early stages. However, it's important to really plan for that slow build and celebrate those small wins. Even a low early turnout is not a reason to get discouraged. Even if a single individual shows up, they might bring another person with them or help spread the word. So we really want to be mindful of celebrating ourselves, even when we're starting small. We also want to address those funding gaps. So sustaining funding beyond pilot events does require a proactive grant alignment and coalition support. We will talk about some tools coming up on how you can get additional funding for your third space activations. There's also stakeholder skepticism. So this is the competing priorities and doubt from partners that can stall out momentum. But it is super important to bring data and stories early so you can show why these third spaces are really needed in your community. We also want to be mindful of capacity limits. So organizational bandwidth is real. Again, you want to start small and build these systems as you grow, being mindful of your time, your capacity, any resources that you may already have available. And last but not least, there is the cultural disruption fear. And this is the fear of upsetting existing culture or partnerships. But this can be managed through code design and transparency, which is why we really emphasize this as a community centered framework where we're including input from our community members directly into the design and planning. And here are a couple of the sustainability resources I just mentioned. So these are ways that we can use strategic messaging and diversified funding. So one of the tools that we have is the messaging triangle. This is for communication. And essentially, it's a framework for clear strategic messaging that really drives action. So it's broken down into three parts. The first one being the problem. What is the issue? This is where you really want to clearly define what's going on in your community and make sure to be specific. And we also want to back that up with data. So, using evidence, statistics, or community experiences that really support what's going on or what you've done in the past. And then, of course, there's the solution. What do you want from it? So, present a clear and actionable response. And this messaging triangle is really flexible and it can be adapted whether you're presenting your third space activation to stakeholders such as the media, partners, organizations, or directly to the community itself. And the other sustainability resource we have is our budgeting bucket. So this is a funding tool, and this helps us identify multiple ways that we can support our event. One of the buckets starts at the city level. So many cities have funds that promote community engagement and public health initiatives. You can apply for these through co-sponsorships. It may even look like logistical or event support. The next bucket is the county level. So this is things such as grants or other public health funding, which really enhances financial support for community initiatives. And you can also tap into community partnerships and donations, whether it's through businesses, organizations, or local retailers. You can really conduct this outreach through donation letters, calls, build upon existing partnerships. And it's important to remember that even the small contributions add up. So, truly, with the messaging triangle, this is how to communicate the issue, and the budgeting buckets is how to find the solution. All right. Still with me, hopefully. Well, before we get into our case study, we just want to talk about a few more resources and incentives. So, this is all about spreading the word and offering perks. These are really evergreen resources that you can use in any third space activation, whether you are a seasoned, sober programmer or this is your first time stepping in. We really encourage you to utilize these, such as your outreach channels. So, using social media, email, in person outreach, word of mouth, this is all about increasing that community engagement and really making this visible. We would like you to consider the cons of some of these methods. For example, people don't always check their email, word of mouth, you may not be able to reach a wide audience. So, we encourage you to tap into multiple channels instead of just one. And you can also use incentives such as gift cards or giveaways. We really encourage you to be intentional about the kind of incentives you're using and make sure they tie into the prevention messaging. You can also utilize community service hours, whether that's offering school credit for volunteers in exchange for their time. And even a little recognition goes a long way. So, rewarding regular attendees with certificates of recognition can help motivate them to keep attending events. And without further ado, I'm going to pass it off to Gaby to talk about our case study.
Thank you, Ruby. That was fabulous. Hi, folks. So, as you can tell, we've kind of set the stage a little bit. We've talked about what third spaces are, why they matter. We've given you the playbook. Now it's time to see it in action, right? And so, for us, in action means West Hollywood. As mentioned before, the IPS has been working with third spaces for over a decade now, and most of that work started really in West Hollywood, which is fabulous. And West Hollywood offers a compelling and complex environment to test the third space model in. It's a community with extraordinary cultural identity, deep LGBTQ plus roots, and a nightlife scene that has historically centered substance use as a part of celebration and belonging. So what does that look like on the ground, right? So as mentioned, it's high density nightlife. Bars and clubs dominate the social landscape, creating strong norms around alcohol-centered gathering, right? If you know West Hollywood in LA, you know it is a nightlife hub for everybody. And so that it really does have that density really baked into its landscape. And it's really important to know what that looks like. Well, I'll slide a little bit after. But this high density nightlife is paired well with a strong LGBTQ plus identity. So the community has fierce pride in its culture and deep investment in spaces that feel authentic and affirming. And as you can tell, so West Hollywood's a neighborhood, right? It has very dense nightlife, and those things aren't necessarily don't necessarily not go together. You know, historically, we've seen that a lot of neighborhoods across the United States, think Boys Town in Chicago, think Hillcrest in San Diego, think West Hollywood in LA. And they are strong neighborhoods with a strong, highly dense nightlife scene. And that is because historically, queer gathering spaces had to be in these bars and clubs because queer folks often face violence and judgment in other spaces, right? So historically, that's why we see this kind of neighborhood so highly dense with nightlife. And that kind of goes well with West Hollywood having a lot of community feedback. Residents and organizations express a desire for more diverse, substance-free alternatives, especially for sober and sober curious community members. So obviously, historically, this community has long been focused on nightlife, has a strong LGBTQ plus identity, and that has resulted in after generations, you know, we see a lot of folks who are sober, who have kind of, you know, fought that addiction and they're looking for those spaces. So the high density and neighborhood qualities also mean that we have a high desire for alternatives. And West Hollywood also has a very fabulous strategic opportunity. The city of West Hollywood, in particular, is committed to innovation in public health and coalition infrastructure, and they're ready to support activation whenever possible. So all this kind of creates the perfect storm for the right place to test this third space model in, right? Um, I do want to showcase one thing that IPS does fabulously is GIS mapping, geographic information systems mapping. And so what this map here is a map of all the on-sale alcohol retailers in West Hollywood. So those are all the red dots. West Hollywood is outlined right there in the blue. And as you can see, there are so many on-sale alcohol retailers. West Hollywood has over 300 alcohol retailers in general in just 1.9 square miles, which is so much, right? And obviously, as we mentioned before, this type of environment shapes behavior. And the behavior that it shapes here is binge drinking. Because there's such a concentration of these alcohol serving venues, we do see higher rates of binge drinking. And you can see this on the map as well. The darker the shade of blue in the area means that the higher the rate of binge drinking is there. So as you can see, that middle section where we see the highest concentration of those alcohol serving venues is where we see the highest rates of binge drinking. So again, that example of environment shapes norms and shapes behavior. And another thing we see a lot here, not just drinking, but this type of like high density lends itself to poly drug use. A lot of folks in these establishments aren't just drinking, they're maybe engaging in, you know, cocaine, meth, things of that nature that they often pair with the alcohol drinking, right? And so what does that look like? Here we have an overlay of another data set. This data set is overdose deaths in West Hollywood. And so as you can see, the little red orbs are where we see some of those overdose deaths. And they're spread out around West Hollywood, but we do see a lot of concentration in the spaces where we see the high density of alcohol serving spaces. Because again, we're seeing so many folks engaging in that poly drug use in these spaces. So the result are things like binge drinking and also things like overdose deaths. Because again, that just becomes the norm of the environment, right? And so our community saw this problem. We understood it was happening. We knew it was going on. And so our first step was to craft that messaging correctly, right? And so as Ruby mentioned earlier, this messaging triangle is a very important tool that IPS has used for so long. And what it does here is it helps craft our message in a way that makes it really accessible to our key stakeholder, whoever that is. And so the way we've crafted it is first is the problem, right? What is the issue? For us, it was that West Hollywood was prone to experiencing high levels of alcohol-related harms. Specifically, West Hollywood was number 3 in LA County for alcohol-related auto crashes and number 5 in LA County for alcohol-related ER visits. And so we kind of did some digging, found some data, and what we found was that West Hollywood's relationship with alcohol is a close one. There's a high outlet density of alcohol serving spaces, right? It's number one for on-sale alcohol retailers in LA County, which again, it's 1.9 square miles. LA County is huge. The fact that it was number one, it says a lot about that, right? In terms of off-sale alcohol, which is the difference is that on-sale is, they serve alcohol and you can drink it on site. Off-sale would be more like a liquor store where you can buy alcohol, but not necessarily consume it. And so for off-sale retailers, it's number 10 in LA County, still pretty high for a city that's 1.9 square miles, right? And this is paired with a high population density. West Hollywood is a big city, very popular city, and it's very densely populated. And this population can really double or even triple on weekends and holidays because it is a nightlife hub. So you're getting a triple population increase on a random holiday like yesterday, St. Patrick's Day. And then because of that, you see kind of those harms start to spike even more. And so, what was the solution that we wanted to kind of pose, right? For us, it was that we wanted to see permanent and one-time third spaces throughout the city. So, what this looked like tangibly was having the city incentivize businesses to hold these third spaces, right, in whatever capacity they can. And that was our main goal. So, putting it all together, the kind of spiel we like to use, I'm going to say it out loud, is my name is Gaby. I'm a Safe for WeHo coalition member. That's our coalition, a group of dedicated to making West Hollywood healthier and safer. We are working to reduce the harms of drugs and alcohol in our community, such as increased DUI incidents, by creating sober third spaces for folks to have fun and make safer choices. We're currently planning to do a pop-up for outreach at blank and blank. Are you interested in hearing more? It's always so important to have that spiel ready because you'll never know when you'll need it. A big thing we do here at IPS as well as media advocacy. So, we'll send out our media releases, send out press releases, and hopefully get media at these events. And sometimes they show up, which is fabulous. But you don't get that much notice, right? Maybe you'll get a call and it's like, hey, they're at the space. Can you run down there? They're gonna do an interview. They're gonna be there in 5 minutes. And it's like, oh, okay, yeah. So I'm driving there and I don't have that much time to think, but luckily I have this little spiel tucked away in the back of my brain so that when the time comes, I'm ready to say what I need to say, right? And it's been so important in getting funding and these kind of media advocacy avenues. And overall, just, getting people on our side and getting people to listen to us, right? It's so important the way we frame the message. That's why the messaging triangle is so important. So obviously we got the spiel ready. We were able to talk to folks. What have we actually activated in West Hollywood though, right? Working with community partners, our coalition has launched a series of third space activations rooted in joy, culture, and authentic community identity. And each event was designed to be visible, celebratory, and clearly substance-free, but without feeling clinical or exclusionary. And so some highlights of the events we've done. First is Boom. That is our historical event, started in 2013 by IPS in partnership with the city of West Hollywood. It's an annual drug and alcohol-free New Year's Eve celebration. The reason this was so important is because New Year's Eve is the number one drinking holiday in the US. And it's, people like to go out and have fun, kiss at midnight, midnight toast, whatever's good. And so we really wanted to tap into that and make sure that folks had some sort of alternative that was equally comparable. So Boom is meant to be a party with drag queens, a DJ, and it's meant to be really comparable to those nightlife venues that a lot of people go to on New Year's Eve. Another example of a great activation is Novemberfest, a sober Oktoberfest. And it's an annual community-based sober social event that is held in the period between Halloween and the winter holidays. Kind of, again, tied to kind of like filling a gap in the calendar year. So folks have something to do, right? So this is a sober drag bingo. We have a drag queen host doing the bingo rounds. We have performances, live music, mocktails, a community resource fair, and it's fabulous, right? Another version of these kind of activations is our resource pop-ups. So we go out to West Hollywood and we are right there in the middle of the Rainbow District on the sidewalk in front of all the bars and clubs, and we get everyone in our coalition to set up tables, and it's almost like a little farmers market. And it's basically just to give resources to folks passing by. We usually do them on Friday nights from like 8 to 11. Again, really honing in on that crowd that might not come to our sober events because they might not think they're that cool. But again, just kind of changing the norms and making these resources something easily accessible and something that folks are okay with. They'll see naloxone, they'll see prevention education resources, and more they'll be like, oh, that's normal because we see that all the time, right? We've actually done 5 in the last year, and folks are starting to just be recognize us, right? Be okay with us just being there, and it feels really good because it really feels like we're shifting those norms. And my last example here is Pride AF Alcohol Free, which was a vibrant alcohol-free rooftop pride concert. And it brought a lot of LGBTQ plus artists together. We put on performances. There was mocktails, resource fair, and yeah, great event, super cool, and it was part of We Hope Pride. But yeah, these are amazing activations we have in West Hollywood, and we're hoping to do more as we go along, right? What made these activations successful? So the success wasn't accidental. Each activation in West Hollywood reflected a deliberate set of design choices, which were grounded in community culture and a strategic approach to prevention that never felt like prevention. So arts and culture were at the center. These events were designed around creative expression and cultural identity, not around the absence of substances. We wanted folks to want to come to these events because there was something to go to, right? Not just because it was sober, because there was something to engage in. And that's what these events were, whether it was dancing, bingo, a concert, there was something there to really bring people in, which was amazing. Community leadership was really successful. Local organizations, artists, and community members drove the programming. So our team in the West Hollywood Project is two people, and it's kind of hard to plan these activations, but we have a fabulous coalition of people, and we tap them on the shoulder when we need them. Novemberfest was put on by our coalition partner, Drag Arts Lab. They have drag queens and they have AV, all that good stuff, and they were able to put it on and make it a great success, right? Pride AF, the concert, we partnered with Queer Sounds, which is a local organization full of queer performers. And it's really important to tap into this network so you can put these on and make them feel really community focused. Strategic partnerships are really important. As mentioned, our partnership with the city is fabulous and it's ongoing. So they actually have co-sponsored and funded most, if not all, these events that we've talked about, which is fabulous, and it just shows how open they are, right? But we also have partnered with cultural organizations, local businesses, and everyone co-investing in visibility and reach means that we can really expand the coalition's capacity and make the event even better, right? All these events were visible and celebratory. It's so important to just be out there in people's faces, not really in a way that's like imposing on them, but just like, hey, this happens. These are sober events and they're fun and people love them. So the events were public, vibrant, and proud. It made them feel more desirable, more cool, and just more normal. Again, shifting norms. And lastly, prevention as texture is so important. As Ruby mentioned, we don't want to be all in their face with the prevention messaging necessarily. We want it to be integrated lightly. Things like resource tables or community resource fairs, QR codes. For drag bingo, we had prevention bingo cards, things of that nature that are just woven in without disrupting the community experience. And so some lessons that we take from West Hollywood and kind of move forward with is that, these activations generated real results and real insight. Number one, as mentioned, community interest must lead. External organizations can support, resource, and convene, but the spaces only thrive when the community that uses them shapes them and owns them too. So top-down activation does not hold, and instead we're kind of really focused on listening sessions or just bringing people's input in as much as possible. Two, visibility shifts norms. The act of showing up publicly with joy, pride, and celebration sends a powerful social signal. And obviously, as we saw, what is seen becomes what is normal. So be as visible as you can, send those media releases, get on the news, get whatever you can do, because we want people to see this. Three, we want prevention that feels like culture because that's what works. When prevention is woven into authentic community experience rather than delivered as a message, it lands. People don't resist what they enjoy. So our queer community, they love drag bingo. They love dancing. They love queer performers and artists. And that's what we've been weaving into these events. And lastly, start sustainability planning early. Funding, partnerships, and infrastructure planning cannot wait. Communities that build sustainability into the design from the start are the ones that actually continue to grow and expand and just get better, right? And so lastly, what we kind of want to leave you with is that third spaces are not a niche tactic. They are a scalable, adaptable model for building the social infrastructure that makes communities healthier for every population in any context. So they're adaptable everywhere, whether it's youth, LGBTQ+, rural, BIPOC, faith communities, the principles apply across every context when grounded in cultural relevance and community ownership. This type of work fits fabulously into the strategic prevention framework and coalition work and any other models you folks might have. It just integrates naturally and it is an easy way to kind of get a lot of that work done and really convene with a coalition and get that strength built up. And lastly, social infrastructure is public health. This is a core reframe for folks. Oftentimes we think of the individual, but investing in things like belonging isn't what we call soft work. It's one of the highest leverage public health strategies that's available to us. And so last question I'll leave you with before Q&A is, what would you change if connection was our primary prevention strategy? It's an invitation for folks to redesign how we think about community health and what it means to truly prevent harm. But yeah, I think that is it. Thank you guys so much. I think we might have some questions, right?
We do. Thank you, Gaby and Ruby. That was amazing. We have about 14 minutes, and so I definitely want to dive into some questions. So the costliness of spaces has been used as justification by legislators to expand alcohol access and bar density across the state. Specifically speaking in California, what can city and state governments do to protect and foster these protected third spaces? And I know, Gaby, in the city of West Hollywood, you touched a little bit on how they're really invested in this. Can you talk a little bit more about that and how IPS has played a role, or the Safer WeHo Coalition has played a role in kind of fostering that, or have they taken the initiative to foster that at the city level?
Yeah, good question. It's been an ongoing relationship. As mentioned, we started these activations in West Hollywood over a decade ago. So starting that relationship early on has really helped a lot. We've seen the payoff of that kind of like early relationship building in the last maybe 5 years or so, because things like Boom being the first one really kind of just set a precedent and showed the city like, hey, this is something that people like and people are into. And so that kind of was like a landslide of like, okay, the city kind of believed that this is a direction they could go in. So for us, showcasing that there's a need there and a want there in whatever capacity you can is a great way to kind of shape the thought process behind, city council or whoever. In terms of West Hollywood, though, as we've kind of gone deeper into the relationship, we've kind of shown them things that like, the alcohol density, what does that mean? That means that we see a lot of higher rates of um, theft and DUI incidences, and showing them that kind of like data is really important because then, that kind of clicks for them like, oh, this is something that we need to take charge in. They have been very open though in giving us resources. So like the city is great at like having applications, for instance. They're not necessarily reaching out to us. It's kind of like they have a built-in infrastructure to like kind of apply for funding for whatever you want to do. So we've kind of taken advantage of those kind of like avenues. And then because we got our foot in the door that way, it kind of lets us kind of like work within that space. And then they come to us for like another event or we become more of a direct contact. But it's like years of building, but I will say the city of West Hollywood has allowed for that to happen through their own avenues.
Thank you, Gaby. I know we have a lot of interest in how the maps were developed. I don't know if Gaby, you want to touch on that, or I can, whatever feels most comfortable to
Um,
talk about.
Yeah, well, I know IPS has an amazing GIS team. So they were able to kind of compile that. I believe the density data is from like ABC, like the alcohol beverage control, the online kind of portal and database. And then in terms of overdose deaths, that is data that we got from the LA coroner's office. It's been hard to get that again, we will say, but we were lucky before and we were able to get that. And so, yeah, that's kind of how we've gotten that data in the past. But the folks that do it are fabulous GIS folks. Shout out to Meredith Gibson, who is our GIS director.
Yes, we have an amazing GIS team. If folks are interested, I will share. I actually see Meredith in the chat, so maybe Meredith can share her contact info if folks are interested in learning more. But Meredith works in ArcGIS and really takes open data sets, but she also has had the ability to take kind of data that we're collecting at a community level through our programs, whether it's through environmental assessments, that our coalitions are doing or other information that we're gathering and overlay that on top of other maps. And her ability to create maps is amazing. And she's got a team behind her who's just doing really great work. So definitely reach out to her if you have questions specific to mapping and what that could look like for your community. Um, when it comes to promoting substance-free events, you guys touched a little bit on this, but want to see if either Ruby or Gaby, you want to expand. So both your programs are substance use prevention programs. So how do you make it, how do you sell the event without being too, obviously for funders, we have to get our substance use messaging or substance use prevention messaging in it, but how do you do that? What does that look like so it doesn't feel too heavy, if that makes sense?
Yeah. Ruby, would you like to go? I know I've been yapping a little bit.
Yeah, sorry. I was giving a moment to see if you're going to respond. This is like such a great question. And honestly, we've gotten to partner with a lot of great people, at least here, both in the Central Valley as well as the East Valley, which was the previous program that I was a part of. And really what we've been seeing is those collaborations really help amplify the message while, getting our resources out while also like gauging interest. In fact, a really great presentation that we got to do was actually on tobacco and vaping. And our program did this alongside another organization called Golden Touch. And so they hosted it at the school during the afternoon. And it was promoted as a family paint night with tobacco vaping presentation. So I thought it was really creative and innovative that they kind of shoehorned, the prevention presentation into this family paint night. So really, we got people to show up who were interested in the activity. Families came together. So this is parents with their children and made it really fun, with music, with a photo booth, just really emphasizing, the interactive elements that they had available at the event. And then a really clever thing that they also did is that we did the presentation first. So, once people sat down, they got their food, they're hearing the music, they got comfortable. They got to hear the messaging and they were really receptive to it because they were excited to be there. They felt welcomed. They didn't feel bombarded. Again, there was things, like the food, like the photo booth, that made it very entertaining to them. So I think that was really disarming, when we came and gave the actual presentation and made it accessible to both the adults and the children that were in the room. And then after that, they got to have a fun paint night. So I think together with that co-collaboration, it was just a really successful event that was both prevention focused and community social focused.
If I can say the quickest thing about that, that is a great example of like knowing your community, for instance, like knowing that it's like you want families there, then do something that appeals to families. Similarly in West Hollywood, we, fold in the prevention messaging like we have a drag king dressed up as we call him Narc Man, which is a naloxone comic about a superhero who saves lives with naloxone, for instance. Like, and we have a drag queen come out in costume because we know that our community loves that. But that's a great example of that.
Thank, thank you both. Just trying to read through some of those questions come in to make sure we can get through all of them. Have you done evaluations of the implementation strategies that were kind of talked about in the Third Spaces manual, or any type of evaluation of the Third Spaces that you've had? What does that look like?
I can let Ruby speak to the manual, but I'll say for us, one thing we've been integrating is like post-event surveys as much as we can. And particularly the information we're getting in those surveys are like, the information presented here made me less likely to use drugs or alcohol. Or this event did not need, like, kind of like, do you agree with these statements? And it's like, this event did not need drugs or alcohol to be fun. This event was comparable to other type of activities offered in the community. Things of that nature to really gauge, is this, not just is this cool, but is this working, right? Are people excited? Is it comparable to the other things that we're kind of up against? So providing that post-event survey and giving that out has been really important.
Yeah, actually, Gaby, similarly, I was going to say like the same thing. Definitely having, I think that was one of the key elements of the playbook itself, in terms of, getting that feedback and making that part of the continuous process. I think one of the great parts about working in prevention is, so much of what we do is interconnected, especially with the communities and the partnerships that we have. And, we get to gather our data and demonstrate there's a need, whether that's through focus groups or even key informant interviews. And what we're seeing across the board, whether it's from schools, whether it's from other nonprofits or local retailers, is they are very much interested in these type of events. In fact, they're saying we need these resources. We need a way to integrate prevention messaging, whether it's about the substances themselves or whether it's about health and wellness. Unfortunately, a lot of times is they're like, we don't have the time, we don't have the capacity, especially because, thinking about, schools, teachers, staff, administration are wearing so many hats. So like, how do we reach our youth, on top of, our core curriculum and the other things that we're trying to serve them? So I think that's just such a great opportunity for us as prevention specialists and practitioners to step up and really fill that gap, because through our key informant interviews, through the data that we've collected, through surveys, through those, post-event surveys as well, there is that need. And I think, it's just across the board a really great opportunity for us to use third space activations to fill the gap.
Thank you, Ruby. And I think it's important to note, and I think something that we do at IPS is, immediately we're definitely looking at those process and outcomes that come from the events that we're hosting, but also long term, what's really changed as a result. So looking at participation numbers and reach over time, who's showing up, who isn't, access to those spaces. Are we seeing changes in who's accessing them and how they're accessing them? And then that community perception, I think that we are really trying to lean into to create that sense of belonging, that sense of connection that people want and are desperately needing. And so just really want to, yeah, I think you guys said it earlier. So just kind of bringing it back to that, I think is important, and building in that community voice. I think, and one thing that I was thinking of that kind of came up because there was a question that someone asked about, rural communities. And while IPS doesn't serve too many rural communities, we do have some that we're serving in San Diego County and in San Bernardino County. And so going to Ruby, what Ruby said earlier about the playbook, it's really meant to be adaptable to communities. And so we're not formally tracking kind of what adaptations are being made and why they're being made and whether those are improving the relevance and engagement in communities, whatever that might be, rural or other diverse communities. I think that's something that we can start to think about tracking. So thank you for the questions that have come up, because I'm like, yeah, we should be doing this because we have so many diverse programs at IPS and different communities we're serving that, Ruby created this playbook to really, it's a model and it can be used, it can be adapted, and we're seeing that across the board in the communities that we're serving. Like in our rural communities, nature is the third space. We have an amazing youth program that is getting youth. They live out in the environment, right? But they don't go out into the spaces that are right next door to them to explore. And so we have a youth program that's connecting youth to nature, to their park spaces and other areas. And that is the third space, especially for our youth who are, in our programming. Let's see. We have some questions about GIS map training. Absolutely. We can look at planning a future webinar around GIS mapping. I know that's always a topic of interest. On our website, publicstrategies.org, we do have webinars that we've previously done that we have covered mapping, not at this level that's being asked, but that might interest those who are asking about that. So with that, I just want to thank Ruby and Gaby. We have come to the end of our webinar and just really appreciate you both for leading us today, and want to give a huge thank you to everyone who was able to attend and sharing this space with us. If you have any questions, feel free to reach out. I've shared Gaby's and Ruby's emails as well as mine. We're here, we're partners. We are always looking to and open to conversations with you all. So thank you all for being here. And again, a recording will be sent out and the slides will be shared out. Thank you.
Thanks, folks.
Thank you.